Thanks, Professor Dr. Marcos, for your kind invitation to share some of my thought on this thermography application with thermal expert like yourself. First topic that I want to share is dynamic synthetic thermal images extraction technique for vein visualization. Right. You please, for those interested, please read this article that we published in this Computer in Biology and Medicine, which a method to produce high contrast vein visualization in active dynamic thermography. Right. Here you can see that we create the synthetic image reconstruction method along the rewarming path. Right. When the cooling application on the skin, right, then after a point the cooling remove, then the rewarming process, you can see here corresponding to this 1, 2, 3, 4, 5, 6, 7, the image, right? The contrast getting better and better when the time evolves. Here just to show the comparison of the current devices, vein viewer devices versus the cost, right? You can see that some vein viewer for near infrared approach is very expensive. So we are aiming for low cost and yet reliable using the just infrared camera without any light source. But the limitation of the vein projection system, you can see that in the current devices, they all use near infrared or LED light sources or a combination of the two. This, unfortunately, doesn't perform well in case of high fat content and irregular skin surface. So are not much help in easing the vein puncturing procedure. Here we propose, which is first of this kind, we have a thermal camera here, then the thermal image data will transfer to the computer for image processing and then synthetic image extraction. We transfer those dynamic synthetic image to a projector, right? This light projector concurrently then image projection onto the arm again, right? The same spot. Of course, just now I mentioned the cooling, right? We have a cold air blowing over the skin, cold air blower over here, right? We are talking about active thermogram, right? We have two types, pulse thermography with cooling technique that we are doing it here versus the lock-in thermography. We are not using the lock-in technique. Right. We apply cooling for 30 seconds, for example here. Then on the removal of the cooling, capturing the rewarming for 200 seconds using the IR sensor. Right. Then we have this so-called tissue activity ratio image reconstruction method that we derive. That I will share a little bit more later on. Right, here is a sequence, right? Those are interested, please read this article again. Thermographic venous blood flow characterization with external cooling stimulation that we publish in Infrared Physics and Technology. Here you can see that initially, right, 0 second starting, then cooling application, a point the cooling remove, then starting count from here 30.5 seconds all the way to 45 seconds. You see the contrast getting better. Here we can show direction of blood flow, diameter of blood vessel, even the velocity of blood later on that we derive it. Yeah, here there is a thermal activity ratio that we propose it, which is the ratio of rewarming rate versus a cooling rate. You can see while time evolve, more and more image that synthetic image you can capture. For example, 4 frames per second, 10 frames per second camera, right? So those tissue activity ratio calculation, and then do the image construction, and then reconstruct the image. Then we can see the base of vein for puncturing purpose. Here again, please read through our article, then you can find out how you define the rate of reforming, rate of cooling, then tissue activity ratio using all these graph. Okay, here show comparison of tau, other people work, right? Tau image, inverted tau, this TAR, tissue activity ratio is our, you can see our approach compared to other previous approach that handle the dynamic images, right? Our technique seems is the contrast gives better. We test on the 3 subjects. You can see the contrast plus standard deviation over the, for example, the tau inverted tau image. Our contrast is better, right? 1.93 versus 1.2178 for subject 2 versus 0.33, right? So you can read out this article, single image reconstruction in active dynamic tomography, a novel approach, published in Infrared Physics and Technology. Right, what I want to show you is here, we also tested this cooling air temperature, 3 cooling air temperature, and we found that in all 3 cooling stimulation cases, given the relative pixel value of the nearby skin tissue is also affected by the same phenomenon. Thus, the resulting contrast value remain largely unaffected. You can see. So the cooling air at 5 degrees C, 8 degrees C, 11 degrees C, all this is not a primary issue. But this I have mentioned just now, starting time, you can see the contrast is good, right? Yeah. So I just mentioned quickly the advantage of our technique, increase the first attempt success rate in cannulation, right? For puncturing. Then skin color and irregularity seems insensitive as in case of existing device. Effective with base skin fat tissue, right? We eliminate the need of rubber band as in case of available devices, and reduction in the cost of cannulation, right? As you know that about 2.7 million procedure of this cannulation, right, conducted daily just in US alone. We reduce the pain, right? Because especially for pediatric patient, reduce the time of cannulation. Then the device can be used to cannulation procedures such as steroid injection, drug, electrolyte, and blood donation, all this. And diameter of the blood vessel can be easily estimated to guide a robotic arm for an automatic image capturing if you the future development, right? And also the dynamic imaging eliminate the motion artifact in the projected image. Right. This is we apply to the breast flap on this tissue activity ratio for the normal case versus the disease. You can see that the cutoff value of 0.94, our sensitivity versus specificity is quite encouraging. And this tissue activity ratio technique that we apply to this breast flap reconstruction, right? It has been published here also. Infrared Physics and Technology for post-operative cancerous breast reconstruction flap necrosis. Right. Finally, I want to share one more topic on this our recent work, physics-informed neural network for the prediction of temperature distribution in cancerous breast as a possible portable AI breast diagnostic tool. We just published it in this computer method and program in medicine. So those interested, please visit this paper. So we have a fully connected neural network over here, right? Which, of course, standard apply the back propagation. But what we have here is physics-informed neural network with the PDE. It's a typical bio-heat equation, right? Then we subject to the boundary condition, initial condition, right, for the transient boundary, another boundary, the normal DTDN, right? Then we can, through the back propagation, we can keep checking the losses, right? So that we can prevent any overfitting, all these things. Yeah. I just quickly show the highlight of this pin work, our normal pin method for the forward simulation of heat transfer through cancerous breast and train pin model with physics law, bioheat, aiming for further inverse thermal modeling to predict tumor size and location. This inverse thermal modeling, we are looking at it now, which is more clinical usefulness, right, rather than the forward. Validate pin by traditional FEM for various cases, and we found that PIN simulation is 12 times faster than the FEM, right, finite element method analysis. And potential of a new portable AI tool for the early detection of breast cancer, which is in line as WHO breast cell examination. Right. Thank you very much for your attention.